All right, hi, my name is Erica Edwards. I'm going to be your nurse practitioner. We're going to perform a head to toe assessment. We're going to start with the head and then we're going to go into the respiratory and the cardiac. And I am going to be feeling, okay? Is that okay with you?
Uh-huh.
Okay, so we're going to start with the head and I'm just looking for symmetry. I'm looking for any lumps, any bumps, any bruising, and any signs of discomfort, which I do not feel. I'm going to feel your temporal pulses. Okay, I do feel them. Now we're going to go into the cranial nerves. Can you please raise your eyebrows for me? Good job. Can you close your eyes shut tightly? Okay, open them. Can you smile for me? Can you frown for me? Can you puff up your cheeks for me? Good job. All right, now I'm going to feel your masseter muscle and I want you to open and close your mouth 3 times. 1, 2, 3, and I don't feel any clenching and no signs of discomfort. Now I'm going to take this cotton swab and I'm going to swab it against your face, and I want you to close your eyes and I want you to let me know when you feel it. You're going to say now.
No.
Good job. Now we're going to look at the outer structures of your eyes. I'm looking at your eyelashes. I'm looking for symmetry. And I'm looking at your eyebrows. Everything looks good. Now I'm going to look at your scleria and your cornea. Open your eyes, please. Everything looks good, and I'm looking at your subconjunctiva. Perfect. Now we're gonna do accommodation, convergence, and EOMS. So I want you to follow my finger and don't move your head, okay? Good job. We're looking for nystagmus. We're looking at the patient's tracking, and this is convergence. Now we're gonna dim the lights and I'm gonna assess your pupils for constriction and consensual, okay? So just look straight ahead. The pupil is constricting, the other eye is converging, pupil is constricting, other eye is converging. Perfect. Now we're gonna do the inner structure of your eye. So I'm gonna just raise your eyebrow and I'm gonna look with it, okay? I see the red light reflex. The blood vessels are nice and medium. I see the cusp and the disc. Can you look laterally for me? And I see the fovea and the macula. Same thing. I see the red light reflex, the cups and the disc. Can you look laterally? And I see the fovea and the macula. Perfect. Now we're gonna go on to the ears. I'm just looking for any discomfort, any pain, any problem with hearing. Okay, perfect. Now we're gonna look inside the ears. So I'm gonna pull the pinna up and back. The TM is nice and pearly and gray. External auditory canal is excellent. To the other ear. Pinna up and back. TM is nice and pearly and gray. External auditory canal is good. All right, now we're looking at your nose, and I'm just looking for alignment. The nose is nice and aligned. There's no deviation. I want to test for patency, so I'm gonna just go like this, and I want you to sniff. Good job. Sniff. Good job. And I'm just gonna look inside your nose, and I'm just looking for any turbinates, any polyps, any foreign objects. Perfect. Now we're gonna assess the outer part of your mouth and then we'll go in the inner, okay? So I'm just looking for any bumps, lumps, or lesions, which I do not see. Can you open your mouth? I'm looking at your no, not yet. Open your mouth. I'm looking at your mucosa, your soft palate, and your soft palate. Lift up your tongue. No lesions. Okay, stick your tongue out. Good job. All right, so now that we did that, we're going to assess your lymph nodes. So I'm gonna feel your pre-auricular lymph node, your post-auricular, your occipital posterior, and then your submandibular, your submental, posterior cervical, anterior cervical. I'm going down to the clavicle. Can you raise your shoulders for me? Shrug your shoulders. Perfect. Now we're looking at the trachea, and the trachea is nice and aligned. I don't see any bumps, any lumps, or any bruising. I also felt the clavicle and I don't feel any noise. Okay, so now we're gonna go on to the thyroid. I'm just looking at your neck. I don't see any lumps or bumps. I want you to turn to the side, and I am going to ask you to put this water in your mouth. Hold it, but don't drink it, okay? Just put a little sip. Okay. The landmark is the Adam's apple. Can you turn to the right and go forward? And I want you to swallow. Good job. I don't feel any bumps. And we're gonna do the same thing for the other side. And I'm just feeling the landmark. I'm gonna go to the side and forward. Swallow. Oh, good job. All right. So now we're gonna listen to your lung sounds. Oh, before we listen to your lung sounds, I'm just gonna assess your chest. You can breathe normally. Everything looks good. I don't see any scarring or anything. Your AP diameter is 2 to 1. I am gonna percuss first, and then we'll listen. And then I'm gonna do your back, which was nice and low. Okay, everything seems well. So now we're just gonna take a listen, okay? So each time I move the stethoscope, I want you to take a deep breath, okay? Good job. Good job. Good job. Good job. Good job. Good job. Good. Good job. Good job. Good job. Good job. Good. Good job. Good job. Now we're gonna listen to the back. Deep breath. Good job. Good job. Good job. Good job. All right. So now I'm gonna assess the cardiac, and I'm just gonna feel your carotid pulses one at a time. Okay. Okay. And now I'm gonna listen to them individually with the bell. Perfect. And now I want you to lean forward, and I'm just looking for pulsation and heaves. Just lean forward. And I don't see any pulsation. That's good enough, sweetie, right here. That's good enough. I don't see any pulsation or any heaves. Now I'm gonna listen to your heart sounds. We'll start with the bell first. Sorry, I'm just gonna lift this a little. Perfect. Now we're gonna listen with the diaphragm. And then under here. Okay, and I'm just gonna ask you to lay down this way, and we'll just do the same thing of the listening, okay? So we'll start with the diaphragm and then the bell. This is the bell. Okay, you can sit up. And we are all done. Thank you so much.
Thank you.